I'm Lawrence Ho. I'm the Professor of Medicine at the National University of Singapore, and it is my great pleasure and honor to welcome you all to the EUS 2018. I have a privilege of working with many US experts in the Asia-Pacific region, and really I have been given the honor of being the inaugural chair of the Asian US group. This is an interest group of experts of EUS in the Asia-Pacific region with the mission of conducting training as well as education of EUS in the region. And since 2012, we've organized multiple workshops and trained many US doctors in this region. I'm honored and grateful to be selected as the chair of the EUS 2018. With this role, I hope I will be able to contribute to the success of EUS 2018. 2018, I believe, is unique in that we are hoping that this will be a learner-centric EUS symposium which complements many workshops which we are currently organizing. By learner-centric, I mean we will emphasize tremendously on the interaction between the trainer and trainees, between faculty and the learners, by having a number of innovative teaching methodologies, such as having the voters' feedback, and also at the same time having interactive sessions where faculty and as well as learners can debate on issues which may not have right or wrong answer. EUS means endoscopic ultrasound, and this is a up-and-coming technology which has tremendous potential as far as the practice of gastrointestinal tract endoscopy is concerned. I believe that now, I think with the advancing EUS technology, we will be using more and more EUS guide therapeutic procedures, and in order to help our patients with GI diseases. The advances currently will mostly be interventional endoscopic ultrasound, and this is why in this particular EUS 2018, we have dedicated one particular session for this topic, and there will be evidence-based discussion on the latest about interventional EUS, where I think experts will be discussing about guidelines and also how we can actually apply the guidelines more effectively in our daily practice. I'm hoping that we can continue to advance EUS, especially in terms of translating guidelines into practice, because there's still a gap between what we know and also the adoption, and more importantly is how we practice EUS in a more effective way. And this is why, again, in the EUS 2018, we'll be doing some sort of debates on issues which may or may not have answers. And we'll also be at the same time looking at the past and the future by introducing certain innovations, which we hope can then be applied effectively in our daily practice. One unique method we are introducing in this EUS 2018 is the use of voters' interactive tools, where faculty will be posing certain questions, and then trainers as well as trainees will be invited to contribute their ideas through voting. And then from the consensus, we'll then discuss about whether I think we should modify what we are doing currently in our daily practice. Of course, being the chairman of this EUS 2018, I hope everyone will be looking forward to joining us in the EUS 2018. I think this EUS 2018 will be the highlight of this year as far as endoscopic ultrasound is concerned, because we are bringing together a very diverse and also talented pool of faculty who has been trained and also been encouraged to interact freely with the trainees during the symposium. So I hope people will join us in enhancing the education as well as the advance of endoscopic ultrasound through this EUS 2018. The 3 I's, meaning that impactful, insightful, and irresistible. Thank you.